is another distinguished person. He's the head of the department of the Institute of Indigenous Medicine. He's the department of, please excuse my pronunciation, Kaya Chikaskista. I'm sure he's going to correct me. Professor N.D. Namal Jayawardena is here. We are so thankful to him. He's going to talk on description of types of traditional medicines and the treatment of body, that is Kaya, by virtue of Ayurveda medicine and, and principles of that. He's got 15 minutes to go. Please welcome Dr. Namal Jayawardena. You can share your slides, Dr. Jayawardena.
Sure. 1 minute, please. And good evening and very good morning to all of the presenters and the organizing committee members and all the professors, doctors, and my dear colleagues. And I am Dr. Namal Jayawardena from the Kaya Chikitsa department in the Institute of Indigenous Medicine. As well as I am one of the traditional practitioners with the combination of two pedigrees. One pedigree is of Kirinelio tradition. Kirinelio tradition means one of the cancer healing tradition, as well as the other one is my grandmother's tradition, the Hadavattuva tradition, that is the Kadum Vidum, that means the orthopedic tradition. And also I combine these two traditions, as well as I added some Ayurveda part also. I did my MT in Benares Hindu University, related to the hepatobiliary system, and now I am practicing all these components. And let me move to the presentation. Okay, actually, my topic consists two major parts. Description of the types of traditional medicine. Traditional medicine is one part of the medical system in Sri Lanka, and the other part is the Ayurveda medicine, and how Ayurveda medicine going to treat for the disorders in body or the Kaya. And in limited time period, I am going to explain these two in brief. And when we are considering the WHO definition, what is traditional medicine, and these the factors including this definition, whether we are having or not. The first they say is the traditional medicine is a knowledge, skill, and practice of holistic health. Definitely we are having the good traditional practitioners, good traditional pedigrees. They are having their knowledge, skills, and the practice in very well. And also the WHO says the traditional medicine is accepted for its role in the maintenance of the health and the treatment of the diseases. Actually, in ourselves also, we are doing the much more things to maintain the health as well as to remove the diseases from the human body. And also they mention the traditional medicine based on the indigenous theories, beliefs, and the experiences. Definitely we are having theories. Our theories are not, we can't correlate those each and every theories with the modern science, but we are having our own science. We are having our own theories, as well as we are believing our theories, as well as we are having the much more experiences from generation to generation. That means our traditional Sri Lankan system is more capable to do the treatment for the disorders, as well as not only the treatment, we are having so many preventive measures for well-being our Sri Lankan people. And the traditional medicine describes a group of healthcare practices, and it produced with the long history of use. Actually, this is time-tested therapeutic measures in the Sri Lankan traditional medicine. And also, but unfortunately, our traditional medicine is having less supportive from the government sector. And also, for an example, there are some traditional systems in Sri Lanka, the traditional Indian medicine system, as well as the traditional Chinese system, and also the Arabic system that is called Unani. Our Professor Vivian also said these every traditional systems, and also we are having our indigenous Sri Lankan traditional system. We are calling this traditional system as Hela Vedakama because in the Sri Lanka in the past we are having 4 tribes in our Sri Lanka, Yaksha, Raksha, Naga, Asura. Likewise, the combination of these 4 parts we are calling Siv Hela. Because of that, the Siv Hela Vedakama, it converted to the Sinhala Vedakama or Hela Vedakama. And the traditional Sri Lankan medicine, we are having the mixture of systems. According to the 1961 Act, there are so many medical systems in our Sri Lanka. The first one is the Ayurveda system of medicine from the North India, and also the Siddha system comes from the South India, and the Unani system from the Greece or the Arab, and also the Sri Lankan identical treatment modality comes. It's known as the Deshiya Chikitsa. In Sri Lanka, now we are having combination of these every system as our indigenous system. And also it's our traditional system is back to 5,000 years. And my second topic is somewhat different. That means it is comes from the Ayurvedic medicine. But this Ayurvedic medicine as well as the traditional medicine, now we are practicing both together for the better treatment. And Ayurveda is not only the treat, but forms a part of life and helps people to stay healthy without any side effects and reduce the disease burden on the society. That means the Ayurveda medicine, it acts as 2 ways. The first one is the prevention aspect, and the second one is the curative aspect. My topic is the therapeutic principle, that is the curative aspect. That means if the healthy persons, that if he or she is having the disease condition, then we have to move to the therapeutic aspect. The therapeutic principles of Ayurveda medicine is to prevent and treat illnesses by maintaining balance and harmony between body, mind and environment. In Ayurveda, it says the Sattva Atma Sarirancha Sanyogam Gare Jivitam. That means for the Jivita or our life, it needs 3 components. Sattva means the mental factor, Atma means the soul, and the Sharira means the body. The combination of these 3 factors, or the union of these 3 factors, called Jivita or life. If any abnormality of in this any factor, it leads to the disease manifestation. I am dealing with the Sharira part today. The other factors responsible for the diseases, other than these 3 factors, there are so many other factors inside the body which leads to the disease manifestation. The first one is dosha. Earlier also said our 2 madams, the 3 humors, the Vata, Pitta, Kapha. These are the major functional agents which can vitiate it and create some disorders inside the body. And also the dosha. Dosha means the body tissues. We call the dhatu. If the dhatus get vitiated, definitely there's a disorder. And also the sotas and the sotodushti. Sotas means the micro and macro channels inside the body. These channels are carrying the various things inside the body. And according to our concept, if these sotas get obstruction or sotas get vitiated, definitely there's a disease condition. and Agni and the Agni Dushti. Agni means the digestive system. That is a major part of our body. The Roga Sarvepi Mandyagnyam. The Acharya says the most of the Nicha Roga, most of the diseases caused by the vitiation of Agni. If the Agni is hampered, then the toxic products can produce. That's called Ama. And there are some other factors, Swabhava, Adhisthana, and Sadhya Sadhita. All these factors can lead to manifest the disorders. And especially if we are considering the disease manifestation, the Kshatriya Kala is one of the major concepts in Ayurveda. Shat means the 6. Kriya Kala means the disease manifestation procedure. Kriya Kala refers to the recognition of the stages of the disease progress. There are 6 stages of disease progress. It helps to determine the appropriate measures to correct the imbalance in doshas. If the doshas get vitiated, if the doshas get sanchaya, prakopa, prasara, then the disease can get manifested. And it is the compound expression, the comprise the kriya and the kala. That means it has 2 words, the kriya and the kala. Kriya means the action. Kriya means the action, the choice to treat. And the kala refers to the stages of progress of the disease. The concept of kriya kala described by the Susruta, it is very essential to early diagnosis, prognosis, and for the adopting timely preventive and the curative measures. That means if we know, as an Ayurveda practitioner, if we know about the kriya kala of the particular disorder, we can get easily diagnose the disorder, and also we can do the proper treatment in proper time. And out of 6 kriya kalas, the first 3, that means the sanchaya, prakopa, and the prasara, are subclinical stages. Sometimes we can understand the disorder in these 3 stages. After that, the later 3 stages are sthana, sanshaya, vyakti, and veda are the clinical stages. Then each and every stage, we have our own therapeutic measures. And there are several approaches of management of disorders. In Ayurveda system, there are so many therapeutic measures mentioned, same as the Siddha medicine. Here I mention only few management approaches. The first one is shodhana, or the cleaning. Before we are doing the treatment procedures, according to the Ayurveda principles or the traditional medicine principles, we are doing the purification procedures. We are doing the shodhana or the cleansing procedures. After that, we are doing the shamana or the palliation treatments. The shamana means we are balancing our 3 humors and the other factors. And the rasayana or the rejuvenation treatment, that means after doing all the treatment, as well as the healthy person also can have the rasayana treatment. And the sattva or the mental hygiene. Actually, in Ayurveda concept, we are not dealing with the sharira or the body. Actually, we are having much more interest about the mental factor also. Because of that, we are doing the sattva treatment. And the management by correcting imbalance. Actually, the Ayurveda treatment is individualized or the personalized approach for the diseases. This is actually the natural therapy. We are using the herbal remedies or the pathway remedies, and we are adding some quantity-wise, the quality-wise, and action-wise benefits for the to treat the disorders, and also addresses imbalance at the levels of physical, biochemical, intellectual, emotional, behavioral, spiritual, and the social imbalance. You can see how Ayurveda and the traditional medicine act. It's at every aspect, not the single aspect. We are not dealing with the symptomatic treatment. And the goal is to heal the diseases, re-establish the balance, of the three humors and also the prevent diseases and the promote health. In Ayurveda medicine, we are not thinking only the symptomatic treatment. Actually, we are doing the systematic treatment. The lifestyle including the exercise, yoga, stress management, using meditation, therapeutic nutritional supplements we are using as a whole, as a combination of these every factors for the management of the disorders. And you can see, this is actually from the Indian website, I got it. And you can see how Ayurveda concepts link to prevent and cure the disorders. There are so many concepts behind the Ayurveda treatment. And the Tridoshavada, Saptadhatu, and the Srotas, Agni, Ama, and Srotas, and everything linked together, and we have to think together to do the better treatment. And thank you very much, and giving this option to explain these things.
Professor Jayawardena, that was very thought-provoking, and I personally learned so many things. And one of the main aspects you brought about the Ayurveda medicine, which we are trying to embrace in the Western medicine, is rather than treating the symptoms, treating the root cause or treating the disease itself. And the best medicine is the lifestyle. So thanks again for bringing up those very important points, Professor Jayawardena.